Hi, I'm Meichen Guo, and you can call me Rachel. Today, my presentation is about the process of technique operation of tracheal intubation. So, we have heard about tracheal intubation as a medical treatment in many medical movies, right? Specifically, it's a medical operation in which a tracheal tube is inserted into the trachea through the upper respiratory tract to ensure the patency of the airway. Currently, it has become an indispensable basic technique in modern medicine and a key technique in ventilation sport. Therefore, establishing an effective artificial airway is one of the basic techniques that should be mastered by medical workers. Tracheal intubation is being used more and more frequently in clinic medicine due to the cardiovascular disease, cancer, and COVID-19 increase. The bar chart shows that the increase in the use of tracheal intubation techniques in recent years. We can see a significant increase in the frequency of using this technique in 2020, which is due to the impact of COVID-19. This is a reason why I would want to introduce this technology to you today. Now, we use two pictures to understand more visual well tracheal intubation is applied. On the left one is a cross-sectional view of the structure of human airway, and on the right one is a series of equipment that will be used in tracheal intubation. The medical instruments is required for the tracheal intubation is not very complicated and consistent mainly of a laryngoscope, a tube, and an anesthetic mask. We will show their specific use in the next steps. Now we will begin to describe the specific steps in the tracheal intubation. First, the doctor will insert an intravenous needle into patient's arm, and the patient is put to sleep through the jaw. Next, an oxygen mask is placed over the patient's nose and mouth to provide oxygen to the patient. Then doctor will temporarily remove the oxygen mask and tilt it back patient's head. Afterwards, a laryngoscope is inserted into the patient's mouth. It will be inserted through the nose in specific cases. The tool has a handle, light, and a blunt blade to help the healthcare provider guide the tracheal intubation. Move the tool towards the back of the mouth, welding the teeth. Elevate the epiglottis, a flap of tissue that hangs in the back of the mouth to protect the larynx. The tips of the laryngoscope is inserted into the patient's larynx and then into the trachea. After that, a small balloon is inflated around the tracheal tube to ensure that it stays in place at the trachea and that all air delivered through the tube reaches the lungs. Next, remove the laryngoscopes and place tape on the side of the mouth or wrap the head with tape to secure the tracheal tube's stability. Check to make sure that tube is in the right position. This can be done by taking an X-ray or by squeezing air from the bag into the tube and listening the breath. When the series of operation is completed, the tracheal tube is ready to provide oxygen to the patient, and the doctor can do the next step of the treatment. Many people may think that I'm not a doctor and I don't need to know about this, but I think that a certain amount of medical knowledge is necessary for us. One we are sick, knowing that the treatments and the principles that doctors use can increase our trust in the medical care and decrease the fear that coming with illness and uncertainty about medical treatments. So that's why I want to tell you about this. Uh, then I finished the introduction for it. Next part is my Q&A part. For first question, I think the content of the fourth week on how to write a correspondence will be the most useful for my working career. Because in my future life, communication with people is essential and sometimes face-to-face communication is not allowed because of like COVID-19, I have said before. Knowing how to choose the right way of communication with letters, memos, emails, and Twitters according to the situation is a useful skill. And for the second question, my main takeaway from this class was learning that we must consider the type of audience when we do our writing. Before, I was just concentrated on outputting my own ideas. Now I realize that I need to improve my writing style according to difference of the audience. This can make my article is understand quickly and effectively. It also shows a respect for different audience. For the third question, there are many differences in the way of their communication and the language. For example, when communicating formally, we usually take the form of letters and emails and use a fixed format. But in the informal communication, we may communicate through social media such as Facebook and Twitter and use some internet buzzword. For fourth question, this class made us realize the important role that cultural background plays in the communication. We should understand the diversity of the culture and be able to respect each other's religious beliefs and political position in our communication. In addition, cultural attitudes are constantly changing and not fixed. For the next question, ethic is a study of the norms of behavior and applies to individuals or groups. So different philosophies has different definition of morality. And when we are faced with moral choice, we can make the right choice based on the criteria of the right, justice, utility, and care. I also know from the class the ethics is not only have black and white, they can influence each other. For the last question, I have gained a more objective understanding of reader-concentrated thinking. Writers need to think about how they can deliver information to readers more effectively. For example, by writing the style and the language that readers can use to uh, the assignment need to respect the culture of the reader, as I said before. This is the most important part. So this is I would like to introduce to tracheal intubation and the understand of the cause. Next, I will apply and learn more about technical writing, future, and thank you for watching my presentation.